If you have a severe infection of your nails, unfortunately, the only thing that I see that works in 30 years is removal of the nail. Sometimes you need to remove the tip, sometimes you need to remove half of the nail, sometimes you need to remove the entire nail. Now you have to understand there's mild infections, moderate infections, severe infections. Mild infections are just slight discolorations of the nail. Moderate infections are more significant discolorations of the nail, but with the absence of thickening, dystrophy, or irregular growth. We also have to understand the physiology of the nail plate. First of all, it's entirely dead and devitalized. So when we have an infection in dead, devitalized tissue, it makes it very, very difficult to treat. This is why you're struggling. The hair is made out of the same material. It's made of keratin. Keratin is invested within the scalp. The scalp has a follicle. In the follicle, that's where we get all the blood flow. That's where we get the viability from. That's where we get immunological, neurological, oxygenation. That's where it gets its metabolism. Once it grows beyond that scalp, it's entirely dead and devitalized. The nail plate is similar. There's a cuticle, there's a hyponychium adhered to the bone. That's where it gets its vascular supply, neurological, immunological, oxygenation, its nourishment. But once it grows in a linear fashion and grows in a horizontal fashion. It takes about 10 months to get from point A to point B. That's why when we cut our hair, nobody says ouch. When we cut the ends of our nails, nobody says ouch. Why? Dead, devitalized material. So that infection in that dead and devitalized material is treatable when it is mildly infected, slight infections of the nail, okay, very superficial. Well, now the topical medications can work, okay? I like white vinegar better than pharmaceuticals. It works just as efficacious as the topicals. The moderate infections, they do well with oral medicine. They also do well with lasers. However, severe infections, you cannot utilize oral medicine and you cannot utilize the lasers for that because it won't work. It just won't work. So therefore, it must be removed. How do we remove it? We give you a little medicine in the arm. You're awake, you're conscious, you're talking, and we administer a little bit of local anesthetic into the toe. I stick a little instrument underneath the nail plate and it avulses very readily. Now, once I've done that, I've rid you of a severe infection and I converted it to an exceptionally mild infection. That mild infection is going to respond to the topical medications, or it's going to respond to what I do for my patient practice is I give them a complementary laser. On a monthly basis, you come in for that complementary laser until the infection is resolved. That's how we do this. When we remove the nail, if it was one of the lesser nails, it hurts for about a day or two. If it's the big toenail, it's going to be sensitive for about 3 to 5 days. But you're able to walk, you're able to function. You just have to wear a comfortable shoe during that period of time. It takes about 4 months for you to start seeing the light at the end of the tunnel, somewhere around 6 months for you to start getting happy with the nail. But you cannot have a severe infection and expect for the oral medication to work or the topical medication to work. It's a waste of time. You're just spinning your wheels in sand. Let's talk a little more about that physiology. So what I see is I see a lot of patients with severe infections. Again, the thickness, the dystrophy, irregular growth, really, really ugly nails. And they're trying to treat it with oral medicine or a topical medicine. The topical medicine doesn't have a prayer in the world of doing that. Why? Well, because the nail plate is impervious to aqueous solutions and oil-based solutions. We've seen patients who have been in the pool, all of our loved ones we know, our family members, us in particular, we've been in the pool too long, the ocean too long, we've been in the bathtub too long. Our skin gets mottled, it changes, but our nail plates do not. It's impervious to aqueous solutions. We've also seen nail polish on nails, pink, yellow, purple, green, orange. Once it's removed, it is no longer that color. So it's impervious to those oil-based solutions as well. This topical medicine does not have the ability to penetrate the nail. It will work on a superficial infection, so potentially a mild infection, an exceptionally mild infection it can work on. The oral medicine and the lasers work good for moderate infections, but not severe infections. I see patients on oral medicine. It doesn't work on severe infections. Why? Again, it takes 10 to 12 months for the nail to grow from point A to point B. The medicine you can only take for 3 months. Why? Because it has a hepatotoxicity associated with it. That means I've got to check your liver function in order to put you on the medicine. I've got to review your liver function every month to make sure your enzymes aren't elevated. I've got to tell you about the potential of abdominal discomfort, prolonged flu-like syndromes, your urine becoming darker, stools becoming lighter. So you can only be on that medicine for 3 months. So while you're on that medicine, there's going to be a relative improvement of growth or resolution at the base and foundation of that nail plate, but only 3 months worth. However, we've got 9 months of disease out here, severe disease out here. When we take you off that medicine at the 3-month mark, which one do you think ultimately is going to win that battle? The 9 months of disease or the 3 months of relative clearing? I think the answer is obvious. So this is what I see patients on topical medicine, oral medicine to treat severe infections. No way in the world is it going to work. The nail needs to be removed once it's severe. My name is Dr. Richard Loninger. I'm a foot and ankle surgeon from Manhattan, New York for the last 30 years. This video is entirely educational. It is not meant to take the place of the patient-doctor relationship. However, if you're interested or you're in the New York, New Jersey area, you're more than welcome to hit that link to my website and make an appointment for a hands-on visit. Or you can have a telemed appointment with me if you'd like. It was nice talking with you. I'll see you next time.